And we now talk to the president of the Philippine Hospital Association, Dr. Jaime Almora. Good morning, doctor. Thank you for joining us.
Good morning, Ria.
Doctor, could you update us on the situation in hospitals across the NCR plus bubble? We know that many are reaching full capacity and can no longer accept patients, just like in that story you just heard.
Yes, the situation is very dire. I actually describe it as a nightmare because the most dreaded thing that we do not want to happen is now happening in reality. And there's so much anguish, so much suffering already, fear, despair, frustration, all those things happening in our hospital, not only with the patients waiting in the long lines of in the ER and in the triads, but much more with the workers who have been there working for more than a year now, extending all their efforts, their capabilities. They're also fearful for their own lives and their families. But you can just imagine their frustration and how they agonize looking at these patients helplessly with their numbers limited to intervene. Seeing patients dying is one of the things that really breaks a health worker's heart, because every health worker want to be of help, but when you become incapacitated, when you're helpless already because of the sheer number, it's really a situation that it's like from the doomsday scenario in the movies.
Right.
That's the situation. The numbers are moving up, and our hospitals are getting overrun by the COVID.
Right. Now, doctor, as we know, this is an extremely difficult situation, and the shortage is not just in terms of beds, but perhaps also in terms of hospital supplies. Could you tell us what supplies are like at hospitals when it comes to equipment like oxygen and ventilators?
Yeah, all the supplies have their limits. The supply of oxygen depends on the manufacturing capacity. In the delivery, the sheer number would overrun also our manufacturing plans for oxygen. But luckily, we also have machines already that then generate oxygen generator, so that can be remedied. The ventilators is not that easy to acquire, and they're running out. The PPE, we have a much better supply now of PPE than before.
All right.
Medicines, yes, depending on how fast the FDA will approve the medicines. The limiting factor here is the FDA. Yes, everything is can run out of supply depending on the supply chain.
Right. Now, doctor, we've got 2 weeks of ECQ. We're sort of just in the middle of that period. Gaano katagal ho bago ma-decongest ang hospitals following this 2-week ECQ?
I don't know how the ECQ would decongest the hospital, but because the reproduction rate is now so fast, it's like exploding now. So yes, the ECQ would help. The longer, the better. But there's so many factors that have to be considered. The economic factor and all those things. So what is really important now is to look at all our approaches and to improve on them. Look at the things that we have not yet done. Like, for example, on detection. There are things that we have not yet done yet to improve the detection. What we are doing now is just contact tracing. But if somebody turns out positive, we go and test those contacts, and we cannot even complete the tracing of those contacts. What we can do now is to equip everyone the knowledge of their COVID status. everyone now should know what is their COVID status. Are they positive or are they negative? And this can be done if everybody will be asked to perform collection of their own specimen and then perform the examination. The rapid antigen test is a fairly sensitive examination. It can be used for surveillance. It has been already proven that positive for rapid antigen test also turns out positive for RT-PCR. The RT-PCR takes so much time to wait for the result. And the rapid antigen test, in a few minutes, you can already have the result. So
Right.
what is important is
You're in favor of self-swabbing then, is that correct?
yes, self-swabbing. I've been promoting that self-swabbing. Actually, as early as March 22 last year, I wrote the secretary already about the possibility of promoting self-swabbing as a way of increasing the detection rate. So if we can increase the detection rate by teaching people to do self-swabbing, because actually self-swabbing is the better way to do it. It is less painful, more, it's just about teaching anatomy to the people, so that they will know where to direct that swab, and because they can feel it themselves, they can feel
Right.
the swab themselves. They can direct it so that it's not painful.
Yeah,
And the rapid antigen test is like a
course,
pregnancy. Yeah, it's like a
in
pregnancy test. So it's easy to perform. And if
Mhm.
people has a knowledge of their COVID status, then they will find a way. They will
That's
find a way to isolate themselves and not infect other people.
Thank you so much, Dr. Jaime Almora of the Philippine Hospital Association. We do appreciate your time.